There is a challenge in determining the best approach to addressing fibromyalgia and other central sensitization syndromes. This is mainly because arriving at this diagnosis is complex, and explaining it to a patient isn't straightforward either. Patients may initially refuse to accept the diagnosis because it doesn't seem to align with their experiences, especially in the early stages with few symptoms. Additionally, clinicians may struggle to explain the complex symptoms that affect multiple systems within the limited time of a consultation. Diagnosing central sensitization syndromes, including fibromyalgia, can be incredibly challenging. There are no specific blood tests or imaging scans that can definitively identify these conditions. The diagnosis relies heavily on a patient's medical history, a thorough physical examination, and the careful exclusion of other potential causes for their symptoms. This reliance on subjective experiences and the absence of objective markers often lead to delays in diagnosis and can be frustrating for both patients and healthcare providers. Patients may feel unheard or dismissed, their experiences minimized as all in their head. This lack of understanding can further exacerbate the emotional distress and isolation often accompanying chronic pain conditions. Adding to the complexity, central sensitization syndromes often overlap with other conditions such as chronic fatigue syndrome, irritable bowel syndrome, postural tachycardia syndrome, and temporomandibular joint disorder. This overlap can make it difficult to tease apart the root cause of a patient's symptoms, requiring a comprehensive and multidisciplinary approach to diagnosis and management. If you tell someone, "I've got a cold," they understand what you mean, don't they? They can relate to the idea of a bug causing a headache, sore throat, or change in voice. We accept it, empathize, and even offer time off work if they're too unwell. But when you say, "I have fibromyalgia or chronic fatigue syndrome," the reaction is often different.
For many individuals with fibromyalgia, the path to diagnosis is rarely straightforward. It often begins with a constellation of seemingly unrelated symptoms: persistent muscle pain, fatigue that disrupts daily life, sleep disturbances that leave them feeling unrefreshed, and often a brain fog that makes concentration a struggle.
These individuals may initially consult their primary care physician, seeking answers and relief. However, the non-specific nature of their symptoms can lead to a battery of tests, each one coming back normal. This absence of a clear-cut explanation can be both frustrating and anxiety-provoking. As their symptoms persist, patients are often referred to a string of specialists: rheumatologists, neurologists, gastroenterologists, and even psychiatrists. Each specialist focuses on their respective area of expertise, searching for a concrete explanation for the patient's suffering. Yet, the interconnectedness of the body and the complexities of central sensitization syndromes often defy easy categorization.
This arduous journey through the medical system can take a significant toll on patients. They may feel like medical nomads, bouncing from one specialist to another, their experiences invalidated and their hope dwindling with each passing consultation.
The emotional and financial burden of this diagnostic process can be overwhelming, highlighting the urgent need for greater awareness and understanding of fibromyalgia and other central sensitization syndromes. In the face of such complex and often misunderstood conditions as fibromyalgia, empathy emerges as a cornerstone of effective care. When patients feel heard, understood, and validated, it lays the groundwork for a strong therapeutic alliance, fostering trust and collaboration in their healthcare journey. Active listening is paramount. Clinicians must create a safe space for patients to share their experiences openly and honestly. This involves paying close attention to both verbal and non-verbal cues, acknowledging the emotional impact of living with chronic pain, and resisting the urge to interrupt or offer premature reassurance. Empathy extends beyond simply acknowledging a patient's suffering. It involves recognizing the profound impact that chronic pain can have on every aspect of their lives, their relationships, their work, their hobbies, and their sense of self. Validating their experiences, even in the absence of objective markers, can be profoundly empowering. By approaching consultations with empathy and a genuine desire to understand the patient's unique perspective, clinicians can transform the healthcare experience. This approach fosters a sense of partnership, allowing patients to feel empowered and actively involved in their own care, rather than feeling like passive recipients of medical interventions. A day in the clinic, a fibromyalgia consultation. Imagine a middle-aged woman with a past sporting injury to her arm who has been struggling with persistent pain that waxes and wanes. She also deals with depression. Her relationship is stable, but she has a special needs child who is having difficulties at school. She has undergone investigations for episodes of chest pain and palpitations, but cardiology discharged her when no pathology was found. A neurologist also discharged her after finding no abnormalities on nerve conduction studies and imaging, despite concerns about possible nerve damage. She's been seen by a rheumatologist for generalized pain in her hands and feet, but no inflammatory joint disease was noted. Only mild osteoarthritis in her shoulders shown on an X-ray. She's currently seeing a physiotherapist privately.
In the past, she suffered from IBS, but manages it well through diet. Now, she's presenting again because of worsening pain radiating all over her body, which sometimes makes her shiver and reluctant to move. How would you address this?
During this consultation, it's crucial to keep an open mind and use open-ended questions to facilitate a conversational approach. The patient should be allowed to tell her story, and you can seek clarification by reflecting her words, using labels, and providing mini-summaries to demonstrate active listening. When the patient feels that you're truly listening, you can confidently introduce the possibility of this diagnosis. Dr. Thompson listens attentively, nodding empathetically, as Sarah describes the impact these symptoms have had on her life. She asks clarifying questions, gently guiding the conversation to gain a comprehensive understanding of Sarah's experience. After a thorough physical examination, Dr. Thompson gently explains her suspicions: fibromyalgia.
Sarah, your symptoms are real. While there's no cure, there are ways to manage the condition and improve your quality of life. You can explain your position further by sharing that you've observed this pattern of symptoms in many patients diagnosed with fibromyalgia, CFS, or ME. The specialists we typically refer to also understand that these conditions present with clusters of symptoms in nodes that correspond to various systems of the body, all connected through your body's regulatory or alarm system. The more excited or activated this system is, the more it can recruit other nodes or clusters of symptoms.
Accepting the diagnosis, navigating uncertainty and stigma. Receiving a diagnosis of fibromyalgia can evoke a mix of emotions. For some, it brings a sense of relief, finally having a name for the invisible enemy they've been battling for so long. For others, it can be met with skepticism, denial, or even anger. The stigma surrounding fibromyalgia, often fueled by a lack of understanding and the absence of visible signs of illness, can make acceptance even more challenging. Patients may encounter disbelief from family and friends who may dismiss their symptoms as all in their head or attribute them to stress or psychological factors. Clinicians play a crucial role in addressing these concerns and facilitating acceptance. Providing clear and compassionate explanations using language that resonates with the patient's lived experience is paramount. It's essential to validate their symptoms, emphasizing that while fibromyalgia is not visible on scans or blood tests, it is a very real and debilitating condition. Education is key. Patients need to understand the science behind fibromyalgia, the role of central sensitization, and the factors that can contribute to symptom flares. Equipping them with knowledge empowers them to become active participants in their own care and to advocate for their needs. Decoding the alarm system, understanding fibromyalgia's roots. Imagine your body's pain signaling system as a delicate alarm designed to alert you to danger or injury. In individuals with fibromyalgia, this alarm system becomes dysregulated, like a faulty smoke detector that goes off even when there's no fire. This dysregulation occurs in the central nervous system, which encompasses the brain and spinal cord. The central nervous system acts as the body's control center, receiving, processing, and transmitting signals that govern everything from movement to sensation to emotions. In fibromyalgia, the central nervous system becomes overly sensitive to pain signals. What might be perceived as a mild discomfort in a person without fibromyalgia can be experienced as intense pain by someone with the condition. This heightened sensitivity, known as central sensitization, is thought to be caused by a combination of genetic predisposition and environmental triggers such as infections, trauma, or chronic stress. Understanding the underlying mechanisms of fibromyalgia is crucial for both patients and clinicians. It helps to reframe the condition, shifting the focus away from a search for external causes to a recognition of the very real changes that have occurred within the central nervous system. The alarm system is malfunctioning. In many cases, you can trace it back to physical or mental injury. This understanding can be empowering, allowing patients to view their condition through a lens of science rather than self-blame. A shared journey collaborative care for optimal management. Managing fibromyalgia is not a one-size-fits-all approach. It requires a collaborative effort between the patient and their healthcare team, a partnership built on trust, open communication, and a shared goal of improving quality of life. Treatment often involves a multidisciplinary approach combining medication management with non-pharmacological therapies. Medications such as antidepressants can help to regulate pain signals and improve sleep. Non-pharmacological therapies play an equally important role. Body reprogramming is one of those care packages, sometimes offered in groups or on an individual basis as well. Its main goal is to help you understand the dysfunction in your alarm system. Exercise, tailored to the individual's capabilities and limitations, can help to reduce pain, improve sleep, and combat fatigue. Low-impact activities such as swimming, walking, or yoga are often recommended. Cognitive behavioral therapy, or CBT, can provide patients with coping mechanisms to manage pain, stress, and the emotional toll of living with a chronic condition. CBT empowers patients to identify and challenge negative thought patterns, replacing them with more helpful and adaptive ways of thinking. The journey with fibromyalgia may be long and winding, but with the right support, individuals can live full and meaningful lives. There's an educational component and an individualized aspect based on which symptoms predominate, whether it's pain, fatigue, memory, or mood problems. Depending on the goals you set, you can tailor your care plan to achieve those goals. By fostering empathy, embracing a collaborative approach to care, and prioritizing patient education, healthcare providers can empower their patients to navigate the challenges of fibromyalgia and become active participants in their own healing.